Mike Lenore, and this is the Wellness Watch. Good health and welcome to a candid conversation on COVID, your children, your concerns, and how to talk to your provider about all of this, about what's real and what's not. Who do you trust and how do you know? And for providers, let's talk about strategies to talk with your patients effectively, especially people of color. The Alameda Alliance for Health is leading this most important discussion. Its CEO, Mr. Scott Coffin.
The Alameda Alliance for Health is working hard with community partners to increase vaccination rates among African Americans and other groups who have been disproportionately impacted by the COVID pandemic. We're incredibly thankful to the African American Wellness Project for lending its voice and urging doctors to encourage more of their patients to become vaccinated.
Thank you, Scott. And helping us today will be some experts and parents from right here in your community. Leading that discussion is Ms. Kim Scott. Ms. Scott is a nurse, a teacher, and most importantly, a mom. Ms. Scott will introduce our speakers.
Thank you, Dr. Lenore. It is an honor to be a part of this discussion. In addition to Dr. Lenore, who is a world-renowned pediatrician and clinical immunologist, we have two moms. Chandra Holsey and Monique Pittman. They each have two children and have lots of questions for our experts. Dr. Oliver Brooks, expert in family medicine, vaccine development, and member of the most important agency in California making decisions about how to treat COVID. And most importantly, chair of the board of the African American Wellness Project. And Dr. Donna Carey, pediatrician, vaccine expert, and mom. We have been gathering information for today's conference for months. We have interviewed the panel at different times, so when you see us, our appearance may vary. Let us know what process you went through to make a decision whether you were going to have your children vaccinated or not against COVID-19.
We actually have two children in separate age ranges. One is 8 and one is 13. So initially, our 8-year-old wasn't of age to get the vaccination. But once it became available for the group of, I believe it's 12 and up, Savannah, I just talked to my husband. We talked about it. He had some concerns. Initially, he was saying that, we wanted to wait a couple of weeks or whatnot. But I was able to convince him to allow her to be an early adopter and go ahead and get it. So we made an appointment and I took her down there and she received her vaccination. And then we went back for the second dose. So it was really, no issue. It was something that we were going to do once it became available for her age range.
So I have two sons, ages 15 and age 11. And I, like Shonda, was not 100% sold on the vaccination when it first came out. I had a lot of concerns about the side effects and the long-term effects. But after talking to my dad, I felt a lot more confident about moving forward with getting the vaccine because I felt like the risk of not getting the vaccine, the risks of not doing that were far greater than actually getting the vaccine. So my oldest son got vaccinated as soon as he was able to. He's age 15. My younger son, who's age 11, is not old enough yet to get it, but I do believe when he is of age, he will get it, although I still do have some concerns with the fact that he's a lot smaller, he's younger, and I know that they're still doing a lot of studies around whether or not younger kids should actually get it, but more than likely, like I said, I will get it, but I am a little bit concerned and also hesitant. I know he won't be the first one to get it when it rolls out for his age group.
The vaccine was initially made for just adults. And now there's a decision to vaccinate children. So what are the current recommendations for vaccinating children and why are we vaccinating them now?
It is really important that children get vaccinated for a number of reasons. Number one, children are a reservoir of infection. So they don't tend to get that sick or have that many issues with COVID-19 if they get it, but they can certainly give it to other people like grandma or father, mother, teacher, and those people will have a harder time. Number two, there have been 1.9 million cases of COVID-19 in the 5 to 11 age group, 8,300 hospitalizations, and about 94 deaths. So there is death hospitalization, and sickness in children. And lastly, the only way we're going to get to the other side of this is to have everyone that can be vaccinated. So then the virus doesn't spread as much. We get less disease. The case rates go down. We get less variants. One final thing I guess I will add too is kids need to go to school. If you test COVID positive, you can't go to school. You can give it to your classmates. You can give it to the teacher. Children need to go to school so their mothers can work, so they can learn. So there are a number of reasons why, and I will also add the vaccine is safe and effective. So for those that are concerned about that aspect of it, the vaccine is safe and effective for anyone 5 years of age and up.
Thank you, Dr. Brooks. You listed some very important reasons why we should vaccinate children. Not only, we know that generally they don't get as sick, however, but it's the people that they come in contact with that can be an outcome of particularly death for a grandparent or either a teacher. And we've seen that happen across the country. Very important. And they need to go to school. I'm a parent myself, and I know what a big difference, or actually what a burden has been to have your kids at home and not be in school. So thank you for those very important reasons why we should vaccinate our children. This next question is for Dr. Donna Carey. Dr. Carey, there's a perception that the vaccine was made too quickly. Can you speak on that for us?
So there were three main reasons why the vaccine was developed so quickly. Number one reason is because we had decades worth of knowledge about coronavirus, the actual virus that causes this particular pandemic. We had a previous experience with it back in 2003 with our SARS outbreak. But at that time, scientists didn't have enough people infected to complete the vaccine process. So because of the studies, they knew exactly what to target on this virus to be able to infect people and to be able to stop it and create a vaccine. So that was the first step. We knew exactly what to target on the virus to prevent infection. The second thing is that because this was a worldwide pandemic, there were many countries who put in resources, time, energy, and money into creating this vaccine. So it wasn't an issue of stopping with each phase and attempting to find the money and the resources to go into the next phase. For this particular vaccine, we were able to combine and do phases 1 and 2 and 3 at the same time without having to be concerned about the finances of the vaccine. And then finally, we were able to cut some of the bureaucracy out of going through the process of getting the vaccine cleared. So because of those three reasons, we were able to get the vaccine at record speed.
Next question is for Dr. Oliver. So we've heard about vaccines for, going on 2 years now. What exactly is a vaccine?
Okay, so a vaccine is a compound, simply speaking, that stimulates an immune response. So I liken it to a picture of a robber. So I show you a picture of a robber. Now this picture cannot do anything to you. It can't infect you. But what it can do is it alert you to the fact that this is who you need to be looking out for. So if this robber comes knocking on your door, you see him walking around in your neighborhood, you call the cops and you say, this is a bad guy. We know it. Take care of this. So a vaccine stimulates an immune response, which are basically what most people hear about are antibodies, but there are also other parts of an immune response. So therefore, they are a sentry at the door of your body. And if the particular infections agent for which the vaccine was developed shows up, your body is already ready. So it gets in and your body says, I'm ready for you, and it kills it, basically. Without a vaccine, your body has no idea what's really going on until it's too late. Your body does ultimately mount a response, but it's after this robber has been all through your house, or after this virus has been into your lungs and your heart and your kidneys, and has already done its damage. And then your body responds and it's gone, but the damage is done. So it is really important that people understand how vaccines work by priming your body to be able to respond to an infection and thereby protecting you from a potentially deadly infection.
Thank you, Dr. Brooks. That is so true. I know in some of the conversations I've had with some of my peers or people, will say, there are all these side effects. And it's so true that you could take a Tylenol, you could take something. We don't know what our body is going to do if we take something, which is so true. So it could be so simple as a Tylenol. And that's it, very important. I just got my flu shot yesterday, and all those signs that you said are common side effects that can potentially happen. I want to talk about some of the myths, right? So we know these myths that we hear prevent people. They're really serious. They prevent people from making informed decision or making the right decision because misinformation. So I want to ask about some myths, and this for you and Dr. Carey. One is, if I get the vaccine, will it give me COVID-19? Another one is, does it cause infertility? And another one is, does the vaccine kill you? Can you die from getting the vaccine?
Dr. Carey, please.
Sure. So the first one is, does getting the vaccine give you COVID? And the answer simply is no. There is no virus that is within the vaccine. So the vaccine is preventing COVID. It does not give you any part of the coronavirus within the vaccine. The second one is it have issues with that cause infertility? And I understand that as a mother. I have a teenage girl who, I definitely don't want her to have any issues with wanting to conceive when she's ready, which better not be now. But when she is ready, I definitely don't want her to have any issues with that. But there is actually no evidence that it has any issues with infertility. The way that the vaccine works does not interfere with the same pathways it works in terms of the process of being able to have a baby. So that's number two, as well as the American College of Obstetrics and Gynecology and the American College of Neonatal Medicine all agree that you should vaccinate pregnant women. And then finally, do people die from vaccines, from this particular vaccine? And I would say very similar to what Dr. Brooks said about side effects. You can never say never, and you can never say no 100%, because everyone will react differently. But the majority of people have tolerated this vaccine without any major issues. And if you look at the number of people, first of all, there's never been any vaccine associated deaths that they can link directly to the vaccine. But there are people who may have had a significant reaction to the vaccine, and that may have contributed to their death, along with maybe having other medical issues. But just as there are car accidents and we still drive our cars, where people go to amusement parks and have these fluke accidents on roller coasters, yet we still ride our roller coasters, there should be the risks of a serious side effect from this vaccine is so low that you would want to take the risk of taking the vaccine versus the risk of getting the virus itself and having it cause long-term damage in your body.
Thank you, Dr. Carey. Those are very important points to make. So next question for Dr. Brooks is about the booster for children. So right now we know that we as adults are getting the booster shot. Do you think that children will need a booster?
That's a very interesting question. I don't know. I mean, the short answer is, and we don't know. I mean, and we're using the term children loosely. So right now, literally the recommendation today was 5 to 11-year-olds should get vaccinated. But back in May, 12 to 16-year-olds were recommended to get vaccinated too. So they're technically still children. And then we'll talk to 15. So 16 on up could get Pfizer, 18 on up could get J&J vaccine or Moderna vaccine. It's interesting. Children respond to vaccines at a far greater or better, to me, rate than adults and certainly seniors. So if there will be a need for a booster, it will be not like adults, because adults, their immunity wanes. And I would presume that children's immunity will wane also, but children respond. The studies showed that even compared to 16 to 25-year-olds, these 5 to 11-year-olds had almost 1.5 to 2 times the response of even these younger children, which is higher than older adults. So at some point, my guess is children will likely need to get a booster. But what we will do, we are doing, is monitoring their immune response over time. And we will see if their immunity drops, if we see more cases as the children get further and further months out from their vaccines, then we'll get there. But I think step one right now, and this is actually really important, beyond boosters and almost beyond the children, we need everyone to get vaccinated. So I'm more interested in that percent of the African American population and the general population who is unvaccinated to get vaccinated versus those that are fully vaccinated to actually get a booster.
Dr. Carey, this last question for you is, should pregnant mothers get vaccinated?
Absolutely. So if you are pregnant, you definitely want to protect yourself from getting coronavirus. We have seen cases. I personally have treated cases where the mother is pregnant, got infected with coronavirus. And as we know, coronavirus likes to attack the lungs. And this particular mom had difficulty breathing. And so we needed to take her baby out early so that could free up the space for her lungs to actually expand and allow her to breathe. And that caused, of course, difficulties with the newborn who wasn't ready to come out, was born premature, and for the mother in her recovery. So we definitely want to prevent that from happening. And the way that we can help to do that is by vaccinating all of our pregnant moms.
Yeah, another one thing that I hear is, well, I heard that the virus infection is not such a big deal, and that if I get it naturally, I'll be better protected anyway. What about the issue of long haulers?
Yeah, so I am more afraid personally of long COVID. Long COVID means that you're having symptoms 6 months or more outside of your acute infection, after you've gotten better, after you've tested negative, whatever. So that is untreatable. Don't really know why it happens, and it can stay with you forever. So the most common things we see are fatigue, brain fog, which is poor cognition, headache. So I couldn't imagine having those things that far out. So the vaccine protects from that. There's even some data that shows that, okay, and then you mentioned getting infected in a natural immunity. So the same way that your immunity falls off from the vaccine, hence the need for a booster, the immunity from the natural disease, which is, again, kind of different. A lot of natural disease does provide good immunity, but with this novel coronavirus, it doesn't. So, no. And now that there's information coming out of data showing that even if you got COVID, you were hospitalized, if you get vaccinated, you are less likely to get long COVID. So I guess I would just want to implore on those who still are really hesitant that the benefits outweigh the risks by, again, 10,000 times. Okay, that's the best. That's the best we can do. I mean, you feel happy we have this vaccine. That's the way I look at it.
Can you take us through a situation where you had a parent who said, "I'm not going to get the vaccine"? You explained it to them, and they changed their mind. And what was the dynamic in that discussion? Was it just simply the trust of your judgment, or were you able to say things that were, I think, convincing to the parents?
No, I think it was a little bit of both, because at least here in California, the children are mandated to be vaccinated or they can't go to school. So that's a very powerful incentive. So mother told me that her child was 11 and she did not want him to get vaccinated because she just didn't trust the vaccine for all the reasons that you stated, and probably others too. So, I mean, I told her, first of all, I'm a pediatrician, I'm a Black pediatrician here in Watts, underserved community. I get no money, no benefit from telling you to get your child vaccinated. So there's no vested interest. I'm not, I don't get paid by the shot. I told her that if I'm vaccinated, my children are adults now, but if they were children, I'd have them vaccinated. And she said, yeah. But I don't like the fact that they're making me get vaccinated to go to school. I don't have a choice. I said, you do have a choice. You have a choice of having your child at home with you, trying to teach him how to, 11th, so 6th grade, starting with, some math, long division, let's say, or something. You're gonna teach them that. And then you're gonna have to be home to be with them. And she thought about it. She said, he needs to be in school. So the school seemed like it was more important than anything else. And so she went on reluctantly and got him vaccinated, and he could go to school. And then he needs his second shot. Let's see. Well, he got his second shot. So now he's going to need a booster. So it worked. And it was that outside influence of a school mandate that made the difference.
I'm Delroy Lindo, and I had the coronavirus. So I know from personal experience how devastating a coronavirus infection can be. Now, fortunately, I fully recovered, but I don't want anyone to experience what I went through. We're living in very dangerous times. On many levels, our communities are under siege, under attack. You know it, and I know it. Now, in the face of that, we need to help and support each other wherever and whenever we can. One of the ways we do that is to get vaccinated against the coronavirus. That protects you, your friends, and your loved ones. With everything we're facing in today's environment, please get vaccinated. Ensure that our communities remain strong, healthy, and well.
All right. I want to hear from the parents and what their thoughts are about the mandate. And they're having their children having to be vaccinated or else. Monique and Shonda, can you weigh in? Tell me what you think about if children are going to be, or the mandate, if their children have to get vaccinated. Monique, you're muted.
So for me, I do have a little bit of a concern for my younger son because he has a lot of pre-existing conditions and especially really bad asthma and allergies. And I know that I've heard everything that you said, and I know the vaccine is the safer route, but I still have a lot of concerns before I actually get him vaccinated. So when it comes to mandates, I don't feel like parents should be mandated to get their children vaccinated. As a parent, you should be able to, you should proceed however you want to proceed when it comes to your child. And I just don't think that it should be mandated across the board, although I do think people are safer by being vaccinated. So I don't know if that answers your question. It's really a dichotomy for me because I struggle from both sides.
Absolutely. That's totally understandable that to not have the right? It's when you don't have the right to choose and you have to do something that changes it. Totally understand that, Monique. It's real. Shonda, what are your thoughts?
I think that I'm a little bit more open to a mandate. And it's because, so for instance, I did not have the chickenpox vaccination when I was growing up. I was exposed to chickenpox, a lot of my siblings, people in my neighborhood was, and we were fine. But then once the varicella vaccination came along and I had children, I was fine with them getting it. So, I just look at it as another vaccination. I feel like this vaccine has been politicized, and I think that factors into just some of the issues that we have. But I believe that a mandate will help us to curb this virus. And so I'm actually in favor of it. Of course, parents have the right to opt out, as with any vaccination. But I do believe that a mandate for children and adults will help us get a better handle on this condition.
Yeah, Shonda, you make a great point in regards to the pandemic being so politicized, where, there's so many moments that you hear, politics getting in front of science, like things that we know work, things that, we've had our vaccinations and gone to school and just how they evolve. I'm a parent as well. My daughter, there wasn't an HPV, vaccine. She just got vaccinated.
Yeah.
we know that vaccines get rid of, diseases that kill. So it's the right thing to do. The being mandated and being required, I think that they possibly, kind of, it complicates things when you don't have that choice. But we know that vaccines work and they save lives.
And that's
Absolutely.
as well, because I know that, and I know that by having a mandate, it would make us safer. But when it comes to your kids, you also always worry. And so, there's just two sides to it, and it's not an easy question to answer especially when it comes to your kids.
Agreed. Yeah, the mandate is serious, and, people are losing their jobs because of they haven't gotten vaccinated. It's very real. I want to open this up to our experts and hear what their ideas are, weigh in regards to the mandate. Dr. Carrier, Dr. Brooks, what are your thoughts?
Yeah. So again, as a mother, I completely understand parents' hesitation to wanting to get a new vaccine, right? I think about my mother in the 70s having to make that very same choice for whether or not I got measles, mumps, and rubella, because it was a relatively new vaccine. But the key here is that vaccine mandates are not new in pediatrics. We do have plenty of, in California at least, plenty of vaccines that say, it's not mandatory for you to get your child the HPV vaccine to come to school, because that is really, affects an individual person. But when you talk about something that is easily spread to other children, that is potentially deadly, then that's where mandates come into play. So all of the vaccines that are mandated because the personal choice that a parent might have for their individual child puts another child who did not make that choice in jeopardy. And whenever we have that situation, that is when it is important to do things like mandates. Nobody likes to be told what to do. We parents don't like to be told what to do about our children. But to keep other children safe, you have to be able to say, you can't be in this environment where there's other people around when you could potentially have a disease that spreads that could then infect someone else and really impact their lives. And that's where the mandates come into play.
That's an excellent point. Dr. Brooks, what do you think about that?
Yeah, I'm really torn regarding mandates. Simple statement is that mandates end up getting more people vaccinated, so more children vaccinated. So they generally are effective. The other side of that is that this is an emergency use authorization if we're speaking about the 5 to 11 years of age. So I'm a little leery of mandating a vaccine that is under emergency use authorization, especially for children. So I can see both sides. I think that there's another part right now. The rate of COVID-19 infection, at least up until a couple of days ago, was diminishing, was dropping. So we were moving almost kind of out of the need for emergency operations. There are a lot of things that go into play when you start looking at a mandate for a child. Dr. Carey made some excellent points about it's infectious in nature, like this is, versus, let's say, HPV, which is not, and it's a personal choice, non-infection that way. Hepatitis B, same way. So I would say that I would feel uncomfortable determining there be a mandate today, the same day that the vaccine was recommended by the ACIP. But I would like to see what happens in the next 30 to 60 days. If we're getting ready we're in the fall, heading into the winter months where we have higher incidence of respiratory viral infections. And we will have another couple of months we have months of evidence of a vaccine being recommended to the 28 million children that are 5 to 11. So give me 60 days of information and then ask me then.
Okay.
Yes, and I agree with that. Can I just say, I totally agree with that. The mandate that I would say we are safe to put into play is the 12 and up, because that is in a full authorized use. In the emergency use, I totally agree with Dr. Brooks that we need to wait and see before we mandate for that age group.
Okay, so we need more data. We need more information to maybe move towards a mandate for this population for kids under 12. Okay. All right. Well, as we close out, I want to ask, what can we do to get more African American parents to be less hesitant, to have more confidence in vaccinating their children? Parents and experts can weigh in. This question is for everyone on the panel this evening. What do you think we can do to increase the confidence among African American parents in getting their children vaccinated for COVID-19?
I'll start.
Go ahead, Sean.
I was actually, I'm from Los Angeles, and I was just in Los Angeles last weekend, and I met with my nephew, and I just assumed that he was vaccinated, and he is not. And I asked why, and he said, "Auntie, I don't trust the government." And I hear that a lot in our community. So I just think that, and also I'm a member of Jack and Jill, and one of my fellow Jack and Jill moms, I just made the assumption that she was vaccinated and she was not. And so I think, one, we can't make the assumption that everyone thinks like us and that they're vaccinated. And we need to have some grace and maybe have some small groups, opportunities for people to talk and discuss their concerns and be empathetic. But those are real concerns. He said, "I don't trust the government." And I'm sure that there's a lot of things that come with that, but just really meet them where they are and address those needs. And those questions. And with my Jack and Jill fellow mom, I saw her a month later and she had gotten vaccinated. And so, I just think that just continuing to talk about the importance of vaccinations and the importance of getting our kids, vaccinated and helping the entire community is helpful. And we just need to be empathetic and persistent and consistent. So those are my thoughts about it.
Thank you, Shonda. Grace and patience.
Absolutely.
And Shonda, you basically said what I was going to say. I think, the African American Wellness Project, I know the mission is to really inform the African American community as a trusted source. And I think that's what needs to happen. More dialogue like this, more forums where parents can ask questions, and just more data and more statistics to debunk a lot of the myths that are out there about the vaccination will probably make a lot of people feel more comfortable with getting it once they hear from more experts and are able to ask their questions like we were able to do so today.
Thank you, Monique. Agreed.
Yeah, I agree. When this vaccine first came out, we started talking about vaccine hesitancy. I hated that phrase. So I started using a phrase that I coined called justified distrust, right? Because within the Black and Brown community, the medical and scientific history that we have, and the misuse and abuse of Black and Brown bodies that dates back pre-slavery, that it's justified that we would not trust a vaccine that was created really quickly with a virus that was relatively new, that not a lot of people had heard about, in record-breaking time. If you didn't have questions, and you don't have questions, then I'm concerned about you. And so I think we need to take time to talk to people, to explain it to them clearly, to hear what it is that they are concerned about, and then to answer those questions as best we can.
Agreed. Thank you, Dr. Carey. Dr. Brooks.
Yeah, so what Dr. Carey said is more important than I think we understood. When you see one justified mistrust individual, you've seen one. So everyone has a slightly different reason why they don't want to get vaccinated. Monique said that mistrust of the government. Was that you, Monique, or Chanda?
No, that was my nephew.
Chanda. Okay, yeah. So here, what it really comes down to is fear. There's a general fear of getting vaccinated, and they come up with 100 different ways to say fear. So you have to understand it is an emotional and not a scientific or objective response. We all have some mistrust of the government. We should in this country, based on the 400 plus years of history African Americans have in the United States. But they have to not mistrust me or Dr. Carey, Dr. Halsey, or Dr. Lenore. So I feel we need to speak from a personal experience and speak to, as best you can do, to speak to their heart. Skip the brain. You can do, well, okay, start with the brain, but end in the heart, because their real issue is something that they feel here and not here. And there's no simple answer. But if you think about it from that perspective and start with that as your approach, then I think you will reach people. I think it's a challenge as a pediatrician. Mothers are very protective of their children. So you got to get through that mother first. I mean, once she makes it in the other side, once the mother makes the decision, that's it. So the child may fuss and fight, but once mom says it's going to happen, it's going to happen. So I, as a pediatrician, really address what that mother's true fear is. Let them know that I've done the research. Past president, National Medical Association, National Medical Associations done the research. California State has done the research. Everyone I know has done the research, and we believe it. So I think when you just take all that into account when you approach this parent, then hopefully you'll get through. And the last thing I say is be patient. There was just, I think what Sean just said, someone finally got vaccinated. I had an employee at work who's been holding out for months. She got vaccinated yesterday. Said she had a terrible reaction. I said, well, you know what? Think about what your reaction would be if you were in an ICU with COVID. So I think that patience is also important.
Wow, that's big. I heard a lot of things that really just hit the core. The patience, the assumptions. Shonda, like you, I have young male cousins who, they came to the house. I wanted to, love on them, and I assumed that they were vaccinated, but they weren't, and very similar reasons. I don't know what they're trying to do to us. They're trying to get rid of us. They don't care about us, right? Yep. And really, the bottom line is it's fear of the unknown. Mm-hmm. And Dr. Carey, for a fact, we were guinea pigs, and that's really real, that we have to acknowledge that it did. Vaccines were used to cause harm. And we have to acknowledge that and recognize that, but also say, there was a Black woman who helped to create this vaccine. So as a community, we know that we have relationship with people, and that people have confidence through relationship and experience, that we have that going for us, and that we should leverage those relationships and the facts, and acknowledging the history and what has happened to move forward to a brighter future, because we know we need us to survive. We need you to survive.
As a doctor who cares for children, is that you almost sometimes feel guilty to express the frustration that we feel about how this infection should be treated and how it should be managed. I mean, we understand the power of the vaccine. We've seen it, yet we still see many, many parents, especially in the African American community, hesitant to even consider getting it. And the reasons and the rationale are not anywhere near what they usually are for decision-making processes. And so I'm almost afraid to say that I'm kind of mad about people who are unvaccinated. I'm kind of mad, not so much because of themselves and their children. I think they may be protected, but the fact that being unvaccinated means we have to live with this virus for far longer than we should. And that vaccinations will make it possible for us to kind of corral this virus and probably get to it before it comes up with a variant that we have to really regroup and start all over with. And so I don't know how to deal with it, Oliver, exactly. I talk to parents every day, and I've never expressed that frustration the way I would really feel. Sometimes I got patients that I've been with a long time say, just go get the vaccine because I told you to get it. But that's not good enough for most parents. I really don't know how to channel that frustration of talking to parents when I know that this vaccine is safe and effective and would make a big difference in the lives of these children. How do you channel your frustration?
So you're stating something that is very true. And for those that are physicians here or aren't healthcare providers, it's really hard to look at people, especially like when I go into a hospital. I have to I see newborns and that the mother is COVID positive and they're supposed to be vaccinated. Pregnancy is higher risk for adverse outcomes. I've got to put on all this stuff just to go in. If you had just gotten vaccinated, none of this would be necessary. So, I mean, I try to channel that into positive actions. In other words, trying to find a way, some other word, some other phrase, some other approach to get those that are hesitant to get them vaccinated. But it's really a challenge. I also think that it's part of being a professional, being a doctor. It kind of goes with the territory. But I will say this: we've never had to deal with this before. I think that people may forget that part of it. We're getting into COVID fatigue to the point that we're thinking this is the way we've always been operating. No, but we as doctors, we really never had to deal with it on this level. I mean, we've had vaccine hesitancy, but it wasn't when we were looking death in the face, where people didn't get vaccinated. People didn't get the flu vaccine. Yeah, there was death, there was problems. But with this COVID-19, this is a pandemic. A once in, 2019, 18, where it was before, so 103 years. I don't have a good answer for you, Dr. Lenore, and you're an allergy immunologist. I mean, you know more about this than almost anybody. I remember what you used to say: don't fall for the okie doke. Maybe try saying that to them one time, and maybe that'll feel a little bit of a release, because you said something that you believe in, and it was not, it was non-contextual. You just said it. So, I mean, that's another thing. Try that sometime.
Yeah, I think we're just going to have to keep talking about it, because the hesitancy seems to be more entrenched now in the people who are refusing to get vaccinated.
Thank you to our moms and our experts. We value your time and your talent.
Thank you, Kim, for leading that superb discussion. It's not an easy subject for neither providers or for parents. And thank you for the Alameda Alliance for Health. Health is your biggest asset, so protect it.